Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again here on Health Professional Radio. We'll be speaking with Dr. Andrea Furlan. She's joining us here as Associate Professor in the Department of Medicine at the University of Toronto and a staff physician and senior scientist at the Toronto Rehabilitation Institute. She's joining us to talk about her new book, 8 Steps to Conquer Chronic Pain, a doctor's guide to lifelong relief. She'll share some insights from the latest scientific research on pain, a bit of advice on attainable lifestyle and mindset changes that have proven successful in her practice for conquering pain, a little bit on how to understand the different types of pain and how they're diagnosed, and a bit about rewiring the brain to control emotions and control the pain. Welcome to Health Professional Radio, Dr. Furlan. Thank you so much for joining us this evening.
Oh, thank you so much for inviting me this day, and it's a pleasure to talk to your audience today.
Tell us a bit about yourself and then some insights from the latest scientific research on pain. I'd love to discuss those with you.
Yeah, so I am a physician specialist in physical medicine rehabilitation, and so I do rehabilitation of people who have chronic pain, which we consider sometimes being a disability because people can't do everything they want, but it's an invisible disability. And the latest research knew that we have developed in the last 30, 40 years is actually the description and discovery and understanding of the pain system. Things that we never thought we had before. We always thought that pain was just a consequence of an injury, a lesion, a damage, a disease. And so if you feel pain, it's because something is wrong. But we know that we have a pain system in our body, and this pain system can be malfunctioning. And when the pain system is malfunctioning, it may trigger some false alarms. It may the pain keeps going on despite the original injury have been healed. So a lot of chronic pain now it's easier to understand, has a disease on itself. And that's why a lot of treatments that we do for acute pain, like opioids, for example, surgery, injections, they don't work for chronic pain. They don't make the person pain-free completely because we are tackling the wrong origin of pain. It doesn't mean the person is imagining or faking up the pain. That's not what I'm saying. What I'm saying is the pain is very real, but it's just the origin is in a different place.
Why is there such a debate as to, what pain actually is? It seems to be so subjective from physician to physician and from patient to patient.
Yes, that's one of the main problems because the patients with acute pain, they can show something is wrong. Like if they have a toothache, an appendicitis, a bone fractured, a nerve that is being pinched, everybody can see and then everybody believes that the person is in pain. The problem is when chronic pain becomes the disease itself because of that pain system is malfunctioning, it's almost like the alarm of a house that there's no more fire, no burglar, no smoke, but the alarm continues going off. And you don't call the fire truck, police, or ambulance. You call the alarm company to come and fix the alarm system. Mm-hmm. So that's what chronic pain, the majority is. They can't find what is wrong. For example, fibromyalgia is a disease that hurts in many places of the body, but the doctors keep trying to find what is the problem they can't find. So they kind of blame the patient. They tell the patient, you must be imagining this must be psychological, you need to lose weight, you need to exercise more, I don't know what is wrong with you, I can't find. They are looking in the wrong place. The person is not inventing that. They have a real pain, but it's not coming from where they are looking for. So it doesn't need to do more MRIs, blood tests, and X-rays. That's not the solution. They need to look in the pain system. And the pain system is kind of invisible to our eyes, but there are some things we now know how to tackle and examine if a person is having the pain system abnormalities, and then we need to then retrain the pain system. That's what my book is about. The first step of the 8 steps is retraining the pain system. It's calling the alarm company to come and fix the noise. You don't call the ambulance or fire truck. You call the alarm company. So that would be the first step. Let's fix the pain system.
8 Steps to Conquer Chronic Pain, a doctor's guide to lifelong relief. As important as it is for a doctor to understand the different types of pain and how they are diagnosed, which I'm going to ask you to expound on a bit, how much more important is it for the patient to understand what pain is and this intricate pain system when talking with their physician? Because if the physician doesn't believe you, then you need to be a little bit more persuasive or knowledgeable.
Absolutely, yeah. So I tell my patients, bring the book to your doctors and tell them, here it is, read this and get the latest evidence, because we know this for so many years, almost 30 years. We know that there is a pain system and this pain system can malfunction. So it is unacceptable that physicians still don't know about this. So the types of pain, basically we divide them into 3 types. One is called nociceptive, which is like, an inflammation, a toothache, an appendicitis, a broken bone. So that's a pain that is coming from that origin. That's the origin of the pain. The second type of pain is neuropathic, which is a nerve injury. So people may have pain because they have a stroke or a spinal cord injury or multiple sclerosis. Those are injuries to the nerves. And they are also easy to see because you can do tests, nerve tests, EMG, electromyographies, and detect where the problem is. And the third type is called nociplastic because it's neuroplasticity. So this neuroplasticity changes happen in the pain system has a consequence of pain. So actually what causes neuroplasticity of pain changes is the nociceptive or neuropathic pain. And of course, I'm not saying that every chronic pain is nociplastic. It's a problem of the pain system. We may have patients who have all 3 types. They have mixed types of pains. So that's why they need a good, physician that understands this and understands these 3 types of pain. And sometimes they have to come to me. I am a pain specialist. That's what I do all day, and I am a specialist in the pain system. But access to a pain specialist sometimes is very hard because we are rare. We're not everywhere. So most pain patients are seen by family doctors in primary care, and they don't have this knowledge and they don't have the time to spend with the patient.
Your book talks about rewiring the brain to control your emotions and therefore controlling the pain. Now, we're talking about pain that physicians can't find any cause for. Is that correct?
Yes. In my book, I don't talk a lot about how to treat and eliminate the first 2 types of pain, nociceptive and neuropathic. That's basically common knowledge among my colleagues and physicians. So I decided to focus more on the nociplastic because that's something that patients don't know and a lot of physicians don't know, although I do talk about them, all 3 types. But I try to focus more on this nociplastic component and how to retrain the pain system because that's a gap that I see in knowledge among my colleagues, physicians, physiotherapists, psychologists, pharmacists, and if they don't understand, they will be doing the same thing over and over for 10, 20 years and not really helping the patients with chronic pain.
When it came to writing this book, what in your personal experience lended to the development of this book, and how much of it was based on your patient base?
Yes, when I decided to write this book was because I know the gap in knowledge that a lot of my patients don't understand what is nociplastic pain, what is the pain system, how they can retrain the pain system. And this comes from 30 years of experience. I graduated from medical school 30 years ago, and I've seen a lot of people who have embraced this type of treatment, and they are so much better. They don't need me anymore. And I say it is possible. I've seen with my own eyes a lot of people getting so much better from chronic pain using this approach. And I want a lot of more people to know it and practice.
And where can we get a copy of your book? I'm assuming that it's available at all major outlets, but is there a website that we can get it and learn more about you and your work?
Yes, so the book is available everywhere where books are sold, online or in your local bookstores. And I linked this on my website, which is www.drandreafurlan.com.
It's been a pleasure speaking with you, and I'm hoping that you'll return and speak with us again.
My pleasure. Thank you for inviting me.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Andrea Furlan. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.